Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart, Life as a Dad and a 35-Year Cancer Survivor, available on Amazon. I want to take a moment and talk about something common among cancer patients: bone pain. Now, I want to stress I'm not a doctor and I'm not going to be giving out medical advice. But what I do want to share with you is my experiences as a 37-year cancer survivor now, versus what I've learned over the years as an advocate for cancer patients and survivors. Now, one of the bad things that happens from going through treatments is it not only goes at the treatments not only go after your cancer cells, but also your good cells, including your white cells. And unfortunately, the drop in your white cells can have an impact on whether or not you get to continue your treatment now, whether it gets delayed, whether it gets modified. So one thing that oncologists do to keep your treatment consistent is by administering a product called Neulasta or Neupogen. And this is basically to give your body the boost it needs to massively, quickly produce white blood cells. Unfortunately, what comes along with that is something described as bone pain. And the easiest way to describe that to you, if you ever experienced as a child as you were growing up, ever hearing the phrase growing pains, okay? Basically, those white cells being created inside your bones are growing so quickly, and that's what's causing that bone pain. Well, there is help to deal with it if you ask your oncologist. And that's exactly how I'm phrasing that so that you don't misconstrue me, or rather, so the algorithm doesn't misconstrue me as giving medical advice, which I'm not. Okay? So, what if you are facing this kind of problem? What I suggest you do is ask your oncologist if you can take Claritin. Okay, and your oncologist will likely give you a very honest answer that there is an off-label use. Okay, that's what they call for a drug that's known for one thing, such as Claritin being for allergies, but it also has the capabilities of preventing bone pain, as given when given during your Neulasta and Neupogen. Now, in 1988 and 1989, when I was being treated, didn't have that option. But then again, I also wasn't given Neulasta or Neupogen. If my cells dropped low enough, my treatment got delayed. Whereas when my father went through his cancer treatments 12 years ago now, he did go through those injections following his treatments. And it was really quite maddening when we met with his oncologist and we got the explanation of everything that's going to be going on and happening. And then the oncologist said, "Do you have any questions?" And I had not, during that entire discussion, heard what happens when he would come for that white cell boosting shot. So I asked the oncologist for him. And I said, "Yeah, doc," I said, "are you going to explain to my dad about taking Claritin for bone pain after you give him, or when you give him those white cell injections?" "Oh, yeah." And the oncologist responded back. He instructed my father to take one tablet the day before the injection, one tablet the day of the injection, and one tablet for the next 2 days following the injection. Now, instructions are probably going to vary between oncologists, but that's information that you can take to your oncologist and ask them. I'm being clear about that. Ask your oncologist about the possibility of adding Claritin to preventing the bone pain from the Neulasta or Neupogen shot. So if you're dealing with that right now and you haven't been able to figure out how to get a grip on that pain, ask that question of your oncologist. If you are already familiar with this and you're experiencing that, drop a comment in a reply to this video and let me know if it worked for you or not. because many people watch these videos, and if they see that there is help out there, and a lot of times we only get that help when we share them peer to peer. Cancer patients, cancer survivors who have been there, done that, gone through this, gone through that. We know what you're going through. So hopefully this helps. Until next time, this is Paul's Heart.